You're listening to Finding Fortitude, a podcast that aims to help former athletes take good care of their minds and bodies through sustainable, evidence-based health habits. I'm your host, Dr. Tori Williams, a physical therapist, coach, and fellow former athlete who is ready to be part of the change in healthcare and who is on a mission to learn and share about all things health and well-being so that you can be equipped with the knowledge and tools to live your best life. As a reminder, nothing shared on this podcast should be considered medical advice. Let's get started. All right. Hello, and welcome back to another episode of Finding Fortitude. Today, I have another wonderful guest on the podcast, and this guest holds a very special place in my heart. She took the leap 2 years ago to trust me with her care, and now I am lucky enough to call her my friend. I'm super excited for you all to hear from her. But before we do, I want to give a little additional disclaimer today because I know many people, when they listen to podcasts, kind of skip past the intro. And if you did, that's okay. It's not a call out. But I wanted to make sure we took a little extra time to provide a disclaimer today. We're going to be talking about some things related to physical therapy and also psychotherapy and mental health. And so I wanted to, again, remind you that nothing discussed on this podcast is considered personalized medical advice. We are just here to talk about our personal experiences and provide some examples and general information. My guest today is a graduate student right now and not yet a licensed health professional. So please talk to your doctor or reach out to a therapist if you are looking for personalized advice on your situation. All right. So now that we have that out of the way, please welcome to the podcast, Miss Payton Bush.
Hi, Tori. Thank you so much for having me here today. The pleasure is all mine. And like you mentioned, I'm currently a graduate student. I'm studying to become a clinical mental health counselor, getting my master's of science in counseling, and so excited to talk to you today about kind of the intersection of mental health and physical therapy. I just think there's so much to get into and so excited to be here today.
Yes, me too. I'm so glad. So to start off, because I'm excited to dive into all of this, but I want the listeners to know a little bit more about you and your background. Do you mind telling them a little bit about yourself and your experience as an athlete?
Yes, definitely. So I started from a very young age playing soccer, played that all growing up, all through high school, and did a little bit of martial arts in middle school, which has given me a very false sense of confidence. And I could do well in a fight, definitely could not. And then I also ran track in high school. And that's really, I think, where I got into a lot of the specifics of being an athlete, and where I got into some issues from a young age with some pain management.
Yeah, so let's dive into that if you're okay with that. Do you mind talking a little bit about your hip injury and what that was like for you when it happened and how it was to navigate the healthcare system?
Yeah, definitely. So, like I mentioned, I've been playing soccer my entire life and was doing a ton of running throughout that. Definitely a lot of plant foot, strike foot, all of that. And then once I got into track, I was doing the 400, the 4x4, the 4x1, the 200, the 300 hurdles. Sometimes all of that within a single meet. And so it was very intense as soon as I got into it. And I'd always loved sprinting, always wanted to be a sprinter, but I think there was a good amount of pressure to try to get into mid distance and to, in the off season, when the season wasn't going, to get into running longer distances and to doing things like cross country. And so going into my last year of high school, my senior year, I was 16 turning 17. And my coaches and my parents had really wanted me to do kind of cross country training and run cross country leading up so that I could have that amazing conditioning to have this amazing final season. And I think 16-year-old me, who had never wanted to do long distances, had decided the best way to get around this was to fib perhaps a bit about how much I had run. The end result of which was I got into cross country and was doing these really intense workouts, and something happened where I just couldn't run. I just fell apart. I could barely walk. I was in excruciating pain, and it was all in my right hip. So went to see a bunch of different doctors, got a bunch of different tests, scans, anything you name it, and no one could figure out what was wrong. There was nothing that was showing up in any sort of chart, but it was very obvious from watching me try to move around that something was wrong.
Mm-hmm.
And so since that day, I'm 29 now, I have had chronic pain in my hip. And it completely impacted the way my final season of track went. And I was never somebody who was like, okay, I'm going to go to college for this, I'm going to scholarship. But it was really painful to have that final season be kind of interrupted with this and interspersed with this now constant chronic pain. And the answers I got at the time were very much, there's asymmetry in your body, and some of this comes from soccer, and who knows, maybe it's something you'll grow out of. And I really struggled with just not having an answer for what had happened. And once I got into college, I completely gave up on running and I completely gave up on sports. I did a little bit of intramural soccer for the social aspect of it. I would go on occasional runs, but it wasn't like I couldn't do any physical activities. I wasn't prevented from it, but I just was living with this now constant pain, and I had no idea what was really wrong or if I could fix it. And to your, point about what was it like in the healthcare system after that, I did go to see different physical therapists on and off over the years. I did try to go to see different, like, people get sports massages, whatever. And no one ever had an answer. And they gave me exercises to do and things to try, but I found it really, really hard to incorporate this little list of exercises into my everyday life once I was working, and I was working like 60 hours a week, with these really intense jobs. And it just felt like a really intense personal failing at decision making when I was young, trying to care for myself afterwards. And so I'm so grateful I started working with you, because it was a completely different approach.
Yeah, thank you for sharing that. I think there's probably a lot of listeners out there that can relate to frustrations in healthcare and not really being able to find answers, and especially those who have this chronic pain after athletic injuries. I think this happens a lot. And there's this aspect of feeling like it's your fault because you can't find any answers, but you're still having this pain. And I think that's a really frustrating, hard place to be in when the people who are supposed to be able to give you guidance and have answers aren't able to provide that. So I'm so proud of you and where you are now and the hard work you've put in the last couple of years to get to where you are. Do you want to talk a little bit about like what you're up to now and kind of how that has evolved for you in terms of exercise and movement and all of that?
Yeah, definitely. I think part of what has really changed for me in the past few years is just kind of my approach around how much I need to do to be an athlete and to exercise. I think when you start off and you're doing really intense workouts, and when the feedback that you're getting is like, it wasn't a good race unless you threw up at the end, and this isn't an effective relay unless you have every single piece of this perfect. And it's not that someone is trying to be that intense with you or pressure you that way, but it does kind of condition you to have a mental attitude about exercise and training that if it's not the most intense version of it possible, you're not doing it right.
Mm-hmm.
And so part of I think the biggest change has just been decreasing the intensity. I don't do crazy runs now. I just walk. And I love that term. It's been one of my favorite additions to my vocabulary. Like, it's okay to walk, jog. It is perfectly normal. And instead of trying to set myself a goal of, okay, I'm going to do a half marathon someday, like, I do 5Ks and I love them, and that is perfectly fine. And maybe I would get to a 10K one day, and I don't ever see myself going beyond that. And it's such a gift to have that mentality now. And I lift weights, but I don't set myself up with like 5 different supersets and we're going to hit every body group and we're going to go do this. So, I have weights at home and I adjust them as needed, and I go lighter in the winter. And I think one of the biggest gifts of that transition is it's easy for me to do. I can do that regularly instead of having these bursts of doing it and feeling guilty when I can't keep up with the standards I set for myself.
Mm-hmm.
Um, So I'm so happy now doing my walks and doing my weights and then just doing whatever other activities I want to do in my week, but none of it has to be this crazy, crazy limit. And I think one of the other things too that's been a big change for me is in working with you. I think when I first came to you, I had like 5 different pages of a write up of what was going on with my hip. And I was like, in this temperature, it feels this way. And this is the exact area. And I literally put it on a chart. And you took me so seriously, which was something I so appreciated. And you listened to all this different input. And we got to a place where I didn't feel like I needed an answer anymore because I feel like you understood what I was talking about. We got to a point where I'm starting to feel a lot better, and the pain is still there, but so much more manageable. And I don't need this set answer to finally justify and explain what happened. I just know what I can do now, and I feel comfortable with that. Um, and that has truly been a change for me in my life.
Yeah. Yeah. And I think that's, again, thank you for sharing that. I think it's having someone take you seriously, to me, in healthcare should be the bare minimum, right? Like I really feel as though, like, as healthcare providers, that is our job, is to listen to the person in front of you. They know their body better than anyone else. Um, and take that seriously and then try to piece the puzzle together for them. And we've talked about like potential, like what may have happened at the time, what may still be occurring now. But like you said, bottom line is that it doesn't necessarily matter. What matters is your function and your quality of life and your ability to do the things that you love, that light you up and keep you moving. And it's been really cool to see you kind of reclaim your inner athlete self, but in such a different context and format, and that it's not this forced, all or nothing, do or die type mindset. It's very much like a much more balanced, like, okay, I can do the things that I want to do. And I do feel like I can get to a sustainable routine, instead of constantly go, 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 100%, burn myself out, hurt more, and then stop, right? We've been able to kind of find this middle ground, which has been really, really cool to see. So, again, I know I said this already, but I'm so proud of you. It's been really cool to watch your journey and see where you've become. And again, it's not like you have zero pain, right? Like I will not sit here and go, look at what we did. We completely took away 100% of your pain. I think there are certain scenarios where that starts as the goal, but then as we move through the process and we realize that there's more shades of gray there, and you feel like you have good control over your symptoms and can do the things you want to do, I think that's where we kind of find the sweet spot. So cool. Anything else on that before we kind of shift gears?
Yeah, I mean, I think to your point too about redefining what it is and reclaiming being an athlete. I think this is where some of that intersection of like physical health and mental health comes in. And for me, so much of that too was um I work really well working with a coach and working with you, and everything that I've had that's come up, I can tell you and I can just be like, hey, this is what's happening. And you've been able to come up with such a good suggestion for me or just hear me out on something. Sometimes I feel like you've been like my therapist on our weekend monthly check-ins. And I've just been able to get things back in my life that I almost didn't think I like deserved to have in a way. Like being sore and enjoying the feeling of being sore. Like that's such an interesting thing that I find with other people who did a lot of sports when they were younger, and to have that back and to feel confident in it. And it's totally fine if 11 pounds made me sore this week and if it's 22 the next. So yeah, I just, kind of that intersection of those different points has been so cool for me to see too, especially as someone who's trying to learn more about a different facet of healthcare and what it means to feel good in your mind and your body.
Yeah. Honestly, if I had like a quarter, if I no, if I had a penny, honestly, at this point, for the amount of times I've been told, like, I know you're like my physical therapist, but sometimes I feel like you're my therapist.
You're a great listener. What can I say?
I mean, and again, going back to what I said earlier, I think at a bare minimum, like especially someone in physical therapy who you get to spend a lot more time with people than maybe a physician or especially a surgeon, anyone like that does, that is a bare minimum skill to me, is that you should be able to listen actively to people. And just in doing that, most people tend to, once you build rapport and they trust you, are more of an open book. And I find that without that, it gets really hard to get at the root of what they want out of therapy, number one, but also how to actually get them where they want to go. So anyways, but yes, that I think when it comes to chronic pain, particularly, but pain in general, like we cannot separate the mind from the body. We just can't. It's all one piece. And so with that, we're going to shift gears and talking a little bit more about mental health. So, can you talk a little bit about why you decided to go into a career in mental health and counseling?
Yeah, definitely. So, like I mentioned earlier, when I got out of college, I was working and I was in this kind of role where it was like 60-hour weeks and really crazy. And I had went to go work in marketing in the tech industry, and there's so much privilege that comes in with being able to like access those kinds of jobs and the salaries that come with that and the benefits that come with that. But it was so high intensity and so much stress over things that I found to be not that worth stressing over. And I saw the negative impacts it was having on people. Just constantly. And I got to a point where I just was miserable and angry and frustrated and stressed all the time. And it was impossible for me to enjoy the things I normally enjoyed. And I went through this period of going like, is there something wrong with me? Like, again, like, am I just like not tough enough for this? And it really took me a moment where I just kind of snapped and I was like, well, let me think about what I do enjoy and what am I really good at. And those things that I really enjoyed were working with other people and supporting other people. And the things that I took seriously and thought were worth stressing over were like, how are you doing in your life? What is going on for you that can help you to feel good and help you to feel better? And so kind of thinking more about like my values and my strengths, and what I was willing to put up with, it became clear to me that, the space I was in wasn't the right fit. So what was the right fit? And realized I wanted to go and I wanted to be someone who could listen to people and support them in a meaningful way. And I wanted to do that through mental health and through, I mean, I'm a chatterbox too. I love talking with people. I'm happy when I'm talking with people all day, including you. So, um, and so I decided I wanted to make that transition, and I wanted to do it in a way where I could get licensed, and I could do it from a really clinical fashion, and I can get more like healthcare adjacent. So that required doing a master's program. So I went and I started that process. It's a 3-year program, the one that I did. And once I graduate, I'll work towards becoming a licensed therapist. And at the master's level, there are certain different licenses you can get, and I can get a little bit more into that later. But the one I'll specifically be going for is an LPCC, a licensed professional clinical counselor. So that requires 3,000 hours before you can get fully licensed of direct and indirect client work. So for
That's a
anyone,
lot.
yeah, for anyone out there who's ever wondered what the process is like to get a therapist, how well trained is your therapist? If it's a licensed therapist, they're doing a significant amount of work. It's a very much a multi-year process. But I wouldn't trade it for anything. I've loved it so far, and I'm excited to get into it further.
Good. Yeah, which brings me back to a point which I should clarify. I made a joke earlier about patients calling me a therapist, but let me be clear. I am not, I am not qualified to be a mental health counselor, period. And so there are absolutely many cases, in fact, where I am referring patients to talk to a mental health counselor. And that's kind of why I wanted to talk to you today, Payton, too, because there are so much in talking to you and our other friend, who's also in the mental health field. I've realized that we call them, oh, it's your therapist, right? Like you hear people talking, oh, I'm going to therapy. But there are so many different areas of therapy that I was unaware of. And so I have learned a lot about, okay, when I'm referring out, like there are options. can you talk a little bit more about the like kind of alphabet soup of all of the different kinds of therapists or counselors? And I know I keep saying therapist, but I think the correct term is counselor, right?
Even just that question is an excellent in terms of it really is an alphabet soup of licenses, certifications, they're all different kinds of things. Yes. And I think one thing you mentioned too that I really appreciate is just this idea of referrals. I think this is such an important thing within anywhere in the health space. People do so much training and work like you yourself did for physical therapy. Like I am nowhere even close to being, competent in that area. But all of us work really hard to refer within this space to people who are experts and to make sure people are getting the best care possible. And within the mental health space, there are many different kind of levels of education and titles for what you might call yourself. So more specifically, if you are going to become a therapist or counselor, at the master's level, there are a few different licenses you can get within the US. So there's the one I mentioned, licensed professional clinical counselor. The actual term for that can change by state too. It just might be LPC, licensed professional counselor, in some states. There's also the more common one, I think, in the state of California is a licensed marriage and family therapist. So an LMFT. You'll see this in the little acronyms behind people's names. And then there's also the licensed clinical social worker, so an LCSW. All of these are people who have done 2 to 3 years of secondary education and then done supervised training for somewhere between 2 to 3,000 hours afterwards. And then they sit for an exam, and there's one that's about, just your competency in the area, and then there's one for ethics and laws as well. So it's a lot of work to arrive at that point. And I think a lot of people wonder, like, between these, what should I choose? What are the different specialties? So in general, a licensed professional clinical counselor is someone who has studied more of kind of, again, I would say very healthcare adjacent sort of cases. You're learning about different pathologies, you're looking about clinical interventions, you're really trying to take an approach where you're learning about the mind and the body in a very specific manner. If you're a licensed marriage and family therapist, you're going to have more specific training that's around working within groups, like a family, working between couples and connections. You'll have more training working with kids and what that's all like. And then if you're a licensed clinical social worker, you're going to be looking at things in a very kind of systems level. So how are people and groups and communities working within the different systems around them, healthcare and otherwise, to try to reach a point of wellness. I mentioned these differences, but all of these different licenses have so much overlap. There's so much amazing training that people are getting across the board. Any of these are people who can help you with most of what you would want to go and talk to someone about. So if you're wondering who to choose and where to go, most anyone is going to be a great option. But if you're looking for something specific, you might want to consider, just those specific nuances. Like if you're someone who wants to go to, couples therapy, and LMFT is going to be an excellent option. Beyond that too, there are people who are getting the PhD level version of this. So you're a psychologist, psychiatrist. So I will never be able to prescribe someone medication. A psychiatrist is very much someone who can do that. A psychologist at PhD level, they've done research, they've participated in all kinds of different things. And, again, for most things you might want to go talk to a therapist about, all of them are a great option. Some of them might just have more specifics that they've studied and trained on, and you can get certifications beyond that. So all of that to say, many different options and lots of different training within the field to make sure that they're competent and ready to work with folks.
Mm-hmm. Yeah, which is awesome. Thank you for that breakdown, because I think that's super helpful, I think, for the listeners, but also for myself as someone who refers out. So for you, are there any other things like that you could recommend in terms of, where do people look to find a therapist, or certain characteristics they should be looking for, that sort of thing?
Yeah, I think that's an excellent question. And certainly something that like even myself as someone who was in school studying this was kind of struggling with like how do I get connected to a therapist that I can relate to and feel good on and is going to be trained in the areas that I'm looking to study. So for anyone out there who's felt the pain and frustration of like, I want to do this, but where do I even begin? Know that we feel that too. We know it's there, but some areas, specific sites you can look on. I think Psychology Today is a really commonly recommended one. And you can search in there just like you would in Google. You know, you have a search bar and you have different filters from there. There are a lot of different kinds of groups, sites that are popping up that are trying to make therapy more accessible and less expensive. So if you're someone who's earning under a certain amount, like Open Path Collective is a great option where you can go and search for more affordable therapy. I know there's different sites too where if you're looking to try, prescription medications and you want to work with a specific psychiatrist, you can go ahead and work with them. So I think a lot of people are trying to look for creatively how do we get around some of the difficulties inherent with our current healthcare system. You can also just go through your health insurance and look on their websites and see if they have specific therapists. I know, like for example, if you have Kaiser, you're going to follow more of their set process with trying to get connected through to someone. But some specific things to consider when you're looking for a therapist. I mean, a lot of people will give the analogy of it's kind of like dating, which to be clear should never happen between someone and their therapist. But there is someone who might be a better fit for you and it might be feel more comfortable, and that's totally normal and natural. No good therapist is going to take that personally if, you sit down for a session with them and decide, I don't know that I really feel like this is someone I could be vulnerable with. So definitely, if you have the ability to shop around, talk to a few different people, because you're going to be building a pretty deep relationship with this person. And it's very normal to look for certain attributes of a therapist too. So when you're going, for example, in Psychology Today, you're searching, you can search for different racial and ethnic backgrounds. So you can try to find a therapist who's someone who looks like you and who you would identify with from a cultural perspective. You can look for someone who's, within the LGBTQIA plus community. You can look for a lot of different factors that are personal characteristics of the therapist or things that they've been trained on, to ensure that this is something that's going to feel, again, really comfortable for you. And you can also look for certain things that they've been trained in specifically. So different kind of therapy modalities. There's some therapists who might be trained in something like EMDR, which is a really specific tactic that involves not just, talk therapy, but also specific like sequences of movements to try to help unlock something from your mind. You need specific training for that. That was something I was interested in trying in the past. You can search for that specifically. So, I know there's a lot of things I kind of shared in quick succession there, but I think really if I can convey one thing, it's just that you as a person who's looking for therapy have autonomy in that process to look for someone who is trained in the things you want, who you can identify with as a person. And it's totally okay to shop around and try different things and meet new people. And you can do it for a few months, you can do it for a few years. It's something that's meant to be tailored and personalized to you.
Yeah, that's really good advice. And I think, speaking for me personally, I know it can be frustrating to try to get connected with someone. I think the first time I ever reached out for help with mental health, one, I never got a response from, and two others said that they were full and that we're not taking clients. And actually another one had said that they didn't take my insurance at the time. So I remember feeling really defeated because I had finally worked up the courage to reach out and being like, oh my gosh, like, and at that time I gave up. And I want to encourage anyone out there not to give up. I know it's a really, really hard thing and our healthcare system sucks, but there are so many therapists out there who want to help you. And it's just about finding the right fit for you. I know that can be hard too, to open up and be vulnerable to multiple people, and that, you can kind of let that take as much time as it needs to take. But yeah, I'm glad you shared that information. I think that's helpful. And that's something that I tell people in terms of kind of the dating around analogy. Like, again, we're not actually dating anybody, but I think even for physical therapists, I tell people like you don't have to just go wherever your doctor instantly refers you to. Like if you've been to a clinic or you've been to with a physical therapist and you don't really jive with them, you don't feel like they're, listening to you, you don't feel like they are the right fit, you are welcome to look around and find someone that would be better for you. And I think that that's, again, we could probably spend a lot more time talking about the flaws in our healthcare system. But you do have autonomy over who you get to work with, and finding the right mental health therapist and physical therapist can go a very, very long way. So awesome. Um, Anything else that you think the listeners should know about mental health, counseling, anything that's been on your mind?
Yeah, I think specifically to your point on just accessibility and the frustrations that can come with it. There's been a big shift in the field to meet with people more remotely now and meet with people virtually. And I think some of this was kind of hastened along by events in the past few years. And that has done a lot to make it, I think, easier for people to get connected. You don't have to go necessarily into a full office once a week and find the time for that. You can do it from the comfort of your own home in a place that feels safe. And while that isn't, a perfect solve to being able to find people and get connected, that is more of an option now than I think it used to be in past years. And I think just the demographics and the philosophy within the field is changing a lot. I think you're seeing a lot more diversity in the field. You're seeing a lot more embracing of different kinds of approaches that don't feel so clinical and like someone's going to turn to you and be like, this is the list of things that are wrong with you and here's how we're going to address this. It is possible to find something that feels more like a friendly rapport, like what you were mentioning. So yeah, as much as possible, just want to encourage people. It can be super frustrating, and if it does feel like something that is for you, though, don't give up on it. Try at different times, try in different ways. And yeah, I just think too, it's also totally normal and valid to want different kinds of care at different times. I think, having this combination for me of seeing my own therapist and then having time with you as a physical therapist, having those two together has been really transformative for me. I think if I was doing just one or the other, I don't know that I would be where I am right now. And so just being open to different things, trying different things, I think they can really go a long way.
Yeah, I definitely think there are different times in your life where things become, you're either more willing to kind of step out and try something new, or it just fits into your lifestyle better. And I think, yeah, keep trying, because there's usually a better time or a different time in your life where things might have a greater impact. I have a couple other questions, and if we run out of time and we need to stop, we can. But something that came up as you were just talking about accessibility and the virtual and online space is every other podcast probably that you listen to, you hear an ad for BetterHelp. And I have my own opinions, but what are your thoughts about a platform like BetterHelp?
It's a great question. And I think um, there are other platforms that are like BetterHelp too, and you're seeing more of these kinds of platforms come into being, trying to solve this problem of it's just so hard to get connected with a therapist and to get the right amount of care, or maybe you can't afford the certain models through your health insurance. Again, we could go on a whole spiel about our current healthcare system and all its different facets. But I think some people find a lot of success in entering something like that and getting connected with a good therapist. I think, for some people, even just having the text functionality of being able to text someone as something that's coming up can be really effective. I do think it can be difficult, though, to try to navigate. It is yet another system to try to navigate to get connected to the right person. Or, if what you are able to do at that time is really only an occasional phone call or an occasional, written messages back and forth. If that is helpful, that is great, but it's not going to be the same experience as sitting and meeting with someone, and getting into really specifics with someone and having dedicated time for it. And totally want to acknowledge it's not something everyone can do at every point in time, but I just it has its own complexities inherent with it. And it's just not going to be the same kind of dynamic. And I think that can really impact people's perceptions of like what therapy is.
Mm-hmm. Yeah. Yeah. And I don't know if you've heard recently, there's like an AI therapist that people can type into this, like, I don't think it's chat GPT, it's some other like platform. And that's super wild to me too. And I think it's trying to address like what you just said, where it's tough to get connected with a therapist. It's not always accessible or the right time for you to really sit down and have one-on-one meetings with a therapist. And it's trying to address a need. I think that a lot of people out there need support and need help. But yeah, like you said, it's just not going to be personable or the same as really building a relationship with someone who can kind of get down to the nitty gritty, anyways.
So I was actually just talking about this with some of my peers the other day, and about the idea of AI within the field of therapy. And I mean, maybe this is just my personal thought at the stage I'm at, but I think there can be a lot of benefit to, there's so many resources out there, right? There's so many like information out there about certain topics. And not every place on the internet can be trusted, but there are trusted sources that have been trying to put out these resources. And if you want to type into something and have a tool that is more advanced, like AI, just immediately spit back a bunch of information and answers specific to some things you're looking for, that can be really great as a way to access more information and learn. But it's not going to be the same as having another human being that has made a connection with you. And, kind of what we learn a lot about is the importance of the relationship and the trust of the relationship and the feedback of the relationship. And, people can make mistakes, but AI and technology make mistakes all the time. They're made by people. So depending on what stage you're at and what you're looking for, there's so much good that can come out of these innovations. But I certainly think I'm a little biased in thinking there's nothing that replaces just meeting with another human being and having them see you, want to help you, and kind of encourage you through the process.
Oh, absolutely. I mean, I think we are in a social health crisis and a loneliness epidemic or whatever you want to call it, but I think there's nothing that beats human to human connection. And I mean, again, maybe I'm biased too, but I don't think I would have had the results that I had from therapy with a robot. I just don't. I think that just takes away completely the impact.
Yep. 100% feel that.
Yeah. Okay, and then my other question, and this kind of circles back a little bit to what we were talking about earlier in the difference between like psychologists, psychiatrists, and therapists, counselors, etc., like going up to that extra PhD level. Something that I hear a lot from people when I ask patients, and I just heard this past week when I asked someone, how's your mental health, and do you have any support? Some people think there's like two sides I see. Like some people are like, okay, well, that just means I'm just talking to someone and that's not going to do anything for me. And then the other camp that I've heard is, well, I don't like to take meds. Like I don't want to be medicated. And I find that really interesting. Can you speak to that a little bit in terms of like when it might be appropriate to talk to a psychiatrist or someone who can prescribe medications versus when talk therapy is appropriate? And I know this is probably could be a podcast in and of itself, but I'm just curious to see like your thoughts on that.
Yes, I see that all the time myself when I'm at work or when I'm not at work. So I think there's this really big perception that you're either going to get this very medical model version of things where it's going to be straight to prescribing something, and that's how we're going to deal with that. And what you talk about is going to be dismissed in favor of just let's just get you on something.
Mm-hmm.
And then there's the other side of the coin, like you mentioned, where it's like, well, I'm just going to talk, and what is talking doing? There's no point in talking and obsessing over these things, or some variation of that. And people don't get to those viewpoints without other influences that have gotten them to that point. They have had someone tell them about this. They've seen other things like this, and it all ties into how we approach healthcare in the U.S. But for the folks who are going, I don't want to be medicated, I don't want to take meds, you never have to take meds. That never has to be the case. And usually that's not the first thing that's recommended. I know there are some cases where, that might be pushed, that might be the first way someone wants to go, but that's not how it's supposed to be. Medication is usually something that is tried after you've talked with someone else first and you've worked on different strategies, or at least, the approach that I've been trained with and would hope to implement myself is you really get to know someone, you understand the wholeness of their life, like them as a whole human being, and then you determine, is this something that would make sense? And for me, that would be a referral to a psychiatrist. That wouldn't be something I would be doing myself. But once that referral happened, and if someone did start on medications, I would be checking in with them all the time. How is this going for you? How does this feel for you? Should we change this? Should we modify it? And it's not something where it's supposed to be like a one and done, you have it, that's it forever. It's supposed to be something that you monitor, you modify, and much like you would, and a training regimen to try to make something feel better. It's meant to be a tool, not a permanent fix. There's some people that go on medications, they're on it for life, and it's something that's really helpful, especially if you have, certain conditions. And there's some things where you try it for a little bit to get out of a depressive period, it's helpful, and then you're done. So you're not permanently tied to one thing. And that's another process that you have autonomy in to say yes or no. And back to the other side of, I'm just going to talk, what is that going to do? I think there's a lot of people that are surprised that if they do try the process, once they start talking, it actually does start helping. I myself have been that person before. You're saying something to a person, and you're like, oh my God, where did that come from? I had no idea. And that's not to say that's the same for everyone, but there are a lot of different modalities within the world of therapy. There are a lot of different strategies to try. So some things might tie into movements of your body more. That's a really big space. Some things might tie more into, we're going to visualize certain things. We're going to have you thinking not about yourself and your experiences, but something outside of you. And as we go through that, it's going to relate back to yourself and your experiences and how you think. There's been so many different iterations and evolutions of different strategies to try that will help someone to discover new things, cope with things in different ways. And even just on a really, really practical level, so much of therapy is just about like, how do you cope? Like, I'm never going to look at someone and be like, the world is perfect and you were the one who needs to change everything. Like, the world is awful in like 50 different ways. So given what we know, how can we work together to give you tools and strategies and a plan? And how can we tailor that to you to make it most effective? So I think it's actually, I'm not necessarily problem solving for the client. I'm trying to help them problem solve for themselves and empower them with the tools and strategies they need, more so than you just sitting there on the couch and going to someone like, well, when I was young, it can be that, but in a conclusion of a very long spiel, there's so much more in it than you might initially think, and that has been portrayed in media, for example.
Oh my gosh, yeah. Truly, there is so much to be offered in that field, and you really don't know until you try. And like you said, I know that there's always usually experiences or ideas in healthcare that will predispose certain people to believe certain things. But like, I could not be a bigger fan of therapy personally. And I love that it was very empowering, and it was very much like giving me the power back to decide how to problem solve, even though it was frustrating sometimes that it was like, I just want you to give me an answer, right? Like, it was like, just tell me what to do, right? And I think a lot of people like understand that and have felt that too in therapy, but I just could not recommend it more. And that is also, to go off on a little tangent, what I try to do in physical therapy as well is that it should be about giving you the tools to be able to regain control over your body and over your pain, rather than me telling you, okay, well, if you do X, Y, and Z and you do this perfectly, like, this is going to take away your pain. I think we like to think that that's how it works, but it's a lot more complicated than that. And I think if we can give people the tools to manage things on their own, that is infinitely more powerful. So, all right. I think that's a good place to wrap up. Before we do though, if people want to connect with you, ask questions, where might they be able to find you? If I
Um,
can get over my words.
Words are difficult. I do them all day and I still haven't mastered them.
Yep.
Yes, if folks ever want to reach out to me, please do. I'm always happy to answer questions. And if I don't know the answer to those questions, refer you to a person or place that might. But you can find me on LinkedIn. My name is Payton Bush, PaytonBush, no relation to the former presidents. And that's the best place to connect with me. And yeah, I always love being a help however I can. And I think that's something that we share, Tori. And I just so appreciate having the space to come on here and talk about some things that I'm passionate about. And really, I cannot thank you enough for how big of an impact you've had for me and my life and reclaiming some of my identity and power in this process. And I just so look forward to talking your ear off every time we meet. Can't wait to do more.
Oh, thank you so much. And I agree. It has been a blast getting to know you and being a small part of your journey over the last couple of years. So thank you. Thank you so much for being here and for sharing your knowledge with us. We'll have to have you come back. There's a light at the end of the tunnel. You're almost done with school, and we'll have to have you come back after you're done and talk about all your new adventures and how work is going for you. And there's lots more rabbit holes we can jump down and talk about in this world of kind of the intersection of mental health and physical health. And you're someone I plan on keeping in my corner for a very long time. So thank you for what you do and all your hard work. And that's it for today. So if you are listening and you liked this episode, please show Peyton some love. Give us a rating or review, and I will talk to you again soon.
Can't wait. Thank you so much, Tori. Bye.